Dr. Sean Riley from Tulsa Spine and Rehab joins us once again. As you know, Dr. Riley, it can be a bit daunting for a patient to visit for the first time. What can a new patient expect when they first set foot into Tulsa Spine and Rehab?
Sure. It's that unknown. And then in addition to that, it's all those bad experiences that we've had in chiropractic offices or physicians' offices, physical therapist office, whatever it may be. And so it's kind of like you said, it's an unnerving situation. You don't know who you're going to see. Hopefully you've done your research and you've gotten online and you were able to check us out before you came into the clinic. Maybe did a little homework on our bios and who we have and what we can do and so forth. So, my goal with every patient that I sit down with is to, try to make them somewhat comfortable with the situation. Every time we go into a physician's office or chiropractic office, we're there because something's wrong with us. Okay. So you got a little heightened sense of anxiety right off the bat. And then, like I said, secondary to that, it could be a bad experience or just the unknown or the environment you're not really familiar with. So I really, that my staff and, all of us here, we're really big on making that first visit, a really good impression on the patient, making them comfortable, answering questions and so forth. I think that's very important. So, we always ask the patients, our staff, first off, we do everything we can, try to leverage technology, emailing, faxing, all types of paperwork to them prior to coming in. So maybe at their convenience, they can take care of some of the paperwork. And, we're just trying to get some, clinical history and information on patients, get that taken care of. And so once they come in, you'll be greeted at our front desk by one of our schedulers. And then I'm also, another thing that I'm really, really big on is, getting patients back in a timely manner. So Scott, I'm sure that last time you went to your primary care physician, your appointment was at 11:30 and you might have moseyed back about noon. Yeah. And so, I recognize that patients' time is just as important as my time. So if someone's scheduled at 11:30 with me, then I want to get them back in a timely manner and get it going. So when they get back here, we're going to sit down and we're going to chat about, their history. So if you're into my office for some low back pain, we're going to go through a history. I want to figure out if there's any, I call them comorbidities or, aggravating factors, which potentially could, contribute to the problem. If there was a significant history of trauma or injury, or heaven forbid, if there was some cancer or something serious, we want to take all these things into consideration. So I spend a fair amount of time with my patients just visiting with them about, what their condition is and other things that's going on. What's their activity level like? How much do they exercise? What do they do for a living? That's obviously a question I always want to know. I mean, do you sit behind a desk for 9 hours a day, or are you out lifting boxes? So, sit down, we'll go through a comprehensive history, and then we'll work into a physical. And, our physicals are really similar to our physical examination to other offices. We want to look at range of motion, and we want to look at, are you tender to palpation? Are you sore in different areas? Neurological exams. We want to check reflexes and sensory stuff, if indicated. Orthopedic type exams. And all these things that we do, we start building a little bit of a story on you. And it gives us some ideas that, you might have you might have one of 5 things going on. And so from there, I want to narrow it down. What we do here a little differently, and I've spoken about this in the past, is we do selective functional movement assessments where we determine, biomechanically where you have limitations, whether it's with flexion or extending or rotating. And so that's another, layer of information that I'm able to gain from that type of exam, which lets me look at someone comprehensively. So let's say you're in for low back, and, I determined that, obviously the low back is the pain generator, but you're really tight in your hips and your thoracic spine or your mid back. And so those are areas that we want to address. What I don't do is I don't shoot x-rays. I sold my x-ray unit 7-8 years ago, and I think that x-ray is a really important diagnostic tool. However, I think it's overused. So if you come in with acute low back pain or just general low back pain, my exam's pretty much going to tell me what I need to know to treat you appropriately, and I don't need to shoot x-rays on you. That being said, sometimes I see patients and their exam tells me one thing, and I might need imaging, whether it's x-ray, MRI, CT. So I do believe in those diagnostic studies. I just don't think that I need to shoot x-rays on every single patient that walks in the door. And from there, I want to sit down. I want to tell the patient what I found in their exam, what their problem is. That is so very important. I feel like so many times that we leave our doctor's office and we're like, I don't know what just happened. What is my problem? And then next, I want to tell them how we're going to fix it. As a patient, I want to know, okay, tell me what's wrong and then exactly how we're going to take care of it. And then, folks are different. Some patients are like, okay, just give me the Cliff Notes version. Other folks are, show me some pictures, show me a video, show me some, very specific type things. So they know what their problem is. They know how long, or they know how we're going to fix it, and then typically how long it's going to take. Chiropractic side of it, my average treatment visit's 4 to 6. So we're really focused on, managing symptoms as quickly as we possibly can, and then showing them things to do on their own, whether it's self-management or, trunk stability or, stretching or strengthening. Those are really important things. And then the advantage also that we have here, if I see a patient, Scott, and you come in and I don't think you're a candidate for chiropractic, then I'm going to maybe get you over to a physical therapist, maybe get you to see one of the massage therapists, or maybe the fitness instructor. So that's that whole comprehensive, integrated approach that we have here at Tulsa Spine and Rehab.
And that is one of the things that makes Tulsa Spine and Rehab unique, is that range of services. Now, it's likely if someone comes in to see you, they're experiencing pain. And you have described that first visit, you spent a lot of time learning about that situation so you can customize a plan for that patient. Can the patient expect any kind of tips or any kind of pain relief at all after that first visit? Anything that you can do or suggest, even in that first visit, that might help with the pain?
Absolutely. Okay, and one of the other issues that I have with a lot of offices as well is that, they're all about, examining and x-rays and trying to determine, what the problem is, and then you're going to come back. Well, that doesn't make any sense. If you're in my office, something's wrong with you. So we're going to do everything we possibly can to get you some relief, whether if that's an adjustment or manipulation on the first visit, or massage or some form of stretching, or maybe we visit about activity modification or doing things differently at your office or your job, or a certain stretch or something in that regard that will make you feel better. So it's so important too that when they leave my office, okay, our office here, they not only know what their problem is, how we're going to fix it, and how long it's going to take, but they also hopefully feel a little bit better. And that doesn't mean that doesn't say that every time a patient comes in, the problem's taken care of, but mentally they'll have some things to do. They'll have a plan. They'll have, they did get some relief in the office. We gave them some recommendations. But we're going to try to treat, and we're going to try to do something on that first visit as well.
The team at Tulsa Spine and Rehab is ready to help you, whether you're experiencing pain and discomfort, or maybe you have some fitness goals you'd like to attain. Contact them today at 918-743-3737.